Today on the Transplant Helper, we're going to be talking about the medications that you may be placed on in the very beginning post-organ transplant.
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle, and I've been asking a number of questions throughout the years. This is just the latest. I think it came in about 5 days ago about the types of medications that we may be placed on post-organ transplant. Now, let me say as a disclaimer right out of the gate, I'm a 2013 heart transplant recipient patient, so my medications may be very different than yours if you happen to be a lung, liver, kidney, or pancreas transplant patient or something else. My medications may be altogether different. However, we're going to be mentioning 3 base categories of medications you may be placed on, and most likely, no matter the organ that has been transplanted in you, most likely that first of the 3 categories is going to be very much the same. Okay, so this will be kind of universal as far as that goes. Let me also add that because I am about an 11-year survivor at this point, that my medication levels and the types of medications I'm going to be on may be slightly different than yours in the beginning as well, because I've been taking off of quite a bit of medications. Thank God for that. I just don't take nearly as much as I used to. So for that reason, it could be a little bit different what I show you today, but I will make mention of what I used to take back in the old but not good days. Okay, so with that being said, there are 3 types of medications you may be given in the beginning. Number 1, they're the immunosuppressant type medications. Those are obviously used to prevent organ rejection. Your body typically and naturally, after receiving a new graft/organ as they call it, after doing that, your body typically would try to reject that organ. It would use its immune system to try to destroy that new organ itself, and the immunocompromising drugs prevent that from happening. Now, there are a number of those that are very typical. For one, the majority of people, no matter the organ type, are going to be placed on a medication that's, at least its brand name is Prograf. Okay, so Prograf is one of those major medications. If you're on more of a generic type, which thankfully I am because it's cheaper, my body does well with that, you may be on something called tacrolimus. Okay, that's just the generic form of Prograf. So Prograf, tacrolimus, I call it sometimes tacrolimus, but nonetheless, those are 2 sister medications, if you will. They do pretty much the same thing with the exception of one being generic, one being brand name. Now, some people do not tolerate one or the other as well. For example, in my case, I can do either, but I know a lot of people that they say that they're not able to tolerate the generic form. It just gives them more side effects. It's not as effective, different things like that. And I know that's absolutely possible, but I think the real key, and this will be the key in any medication that you take, is if you're having issue with that, yes, the first line of defense may be to swap that medication out for something else. But if that doesn't seem to help, you might also want to check out the manufacturer, because all manufacturers are not created equal. Some of them use more fillers and different things in that may be actually what's causing your issue or your side effects. So be sure you check with the manufacturers. They're not all created equal. For example, Accord is one of those mainline manufacturers that I do very, very well with. I have no issue. Others like Dr. Reedy's, I've got entire videos on them. You should always use caution. If you look down at your medication bottle and the brand name happens to be Dr. Reedy's, the quality there is just not always there, and sometimes those fillers can cause some problems. But that's 2 of the main medications you may be on, tacrolimus and or Prograf. That's just those 2 versions. Second to that, you may be on a medication called Myfortic or microfenolate acid. Now, these are just 2 very slightly different formulations that you may be offered in the beginning. These 2 are immunocompromising drugs. They're going to work really hard and really effectively in most people to really help you to prevent rejection. If you're not able to tolerate either one of those, something like Surimus is another option that they may give you, and some people, again, enjoy or can do better with one or the other. But I have always taken microfenolate acid. That's the version or the form that I'm on. I've got them right here in front of me. This happens to be them. These happen to be just a very small, very greenish blue pill. I mean, there's not much to them. I take 3 of those twice a day, basically, is what I'm down to now. In the beginning, I took quite a bit more. Same thing with the Prograf. I didn't show you that. Or tacrolimus. These, for me, happen to be a little tan and / white pill. And depending on your dosage, the coloring will change on these as well. I think the smaller capsules than what I take, they've got 5 milligrams, 1 milligram. I think you can even get a half a milligram. Depending on that, they'll be colored differently, but that's what mine are. But that basically, for me, again, these are the only two immunocompromising medications I'm currently on, nor have I been on for a long, long time. And that's a blessing within itself, because some of the side effects that come in with just these two medications, for example, oftentimes the tacrolimus, the little smaller pill here, that pill right there can cause quite a bit of problem as far as getting the jitters, the shakes, feeling like you're nervous all the time. It can cause some actual anxiety itself. It can cause some sleepless nights come along with this one. Most people don't tie that to there, but it is part of that. Different side effects come in from that. And then the myfortic, or mycophenolic acid that I mentioned, the blue-green pill, that thing is a stomach bomb, okay, basically, for some people. And so that's why I'm on mycophenolic acid instead of the original myfortic. It just did better with the gastrointestinal system. Wasn't as many downloads, if you will, after swapping over. But it's the best practice to always report to your doctors any side effects that you happen to notice and let them try to work through that. Don't feel like that in the end of things that you're going to have to face some terrible side effects just because you had a transplant. Now, there will be some side effects, and some of them will be what I call unget-overable or unavoidable, but at least I can make a few swaps in the beginning and see. And a lot of it will come down to, as time goes on, when these dosages begin to come down, sometimes things get quite a bit better anyway. So these are not near the dosages I was on back in the beginning. That's just what I'm on now. So that's kind of the main two. Now into this, I don't happen to have a bottle of this. Thank God I don't have a bottle of this. But in with these two, typically speaking, in the beginning, you're going to be put on a corticosteroid called prednisone. Now, I like to refer to prednisone as the devil's drug. I've got a whole series of videos about this medication, but it does its trick, okay? There's no doubt about that. It can cause some pre-diabetic type of reactions, and I mean by that literally, I never had any problems with my blood sugar upon taking that in the beginning when I was on very high dose prednisone in the beginning. I think I was taking 60 milligrams of that a couple of 3 times a day. My blood sugar levels were shooting out of the roof, 400 in an instant nearly after taking that medication. When you taper off of that, that gets a lot better. Of course, they do things to manage that. I was actually temporarily on some insulin shots to try to bring the blood sugar down, but it was kind of a catch-22 there between the risk and the benefit, or the benefit and the side effect there that you just had to be on. But that prednisone is very important in the beginning, and for the most of us, we at least get down to what's known as kind of a baseline, or a maintenance type dosage, which is only 5 milligrams. That's a whole lot different than taking 60 twice a day or more. And so things do get a lot better. I am blessed that for the last 7 or so years, I've not been on it at all. I don't need it anymore, so that's good. There'll be times if I were to go into rejection, which again, I'm blessed in that I've never had any form of rejection. But if you do, that's the first medication they're going to go up on. They're going to go up on the prednisone, probably up on the Prograf/tacrolimus, up on the myfortic, at least for a time, and that's how they're going to help to treat some of that. But that's kind of the basic immunosuppressant or immunocompromising drugs right there. Number 2, there are also what I refer to as baseline drugs. One of them I mentioned already might be insulin in the beginning. Hopefully, Lord willing, you wouldn't be on that for a long period of time. But in the beginning, I needed that. Don't have any of that anymore because that was temporary, but that's kind of a baseline drug. And what I mean by that is sometimes these medications throw the levels off on something else, and then they have to give a baseline drug to correct that issue. Something that's overcorrected, they have to correct. Insulin will be one of them. Another form of those medications that could be included in that, let me look here if I can find it. I actually have taken in the past a drug called metoprolol. Now, metoprolol helps to deal with a very higher heart rate or higher blood pressure, and it helps to regulate that. Sometimes they use it in certain doses, believe it or not, to bring the heart rate up. They've used it in other doses to bring the heart rate down. And by the way, a high heart rate after a heart transplant is just a part of the game. Your resting heart rate may suddenly become 90, 95. That's going to be typical. That's going to be average. Your doctor's going to be fine with that. But then there are also other times when if it stays too high, especially if the blood pressure follows that, they may put you on a maintenance medication like metoprolol, or what I call a baseline medication, to bring those baselines down. Another medication I happen to be on now, is ditalzine. Now, ditalzine typically is a blood pressure regulating medication. Okay, it's just a little, let me see what this one is. This one happens to be just a little blue and white, kind of a pretty pill actually. The little blue and white pill there. I only take one of those in the morning. I think these are 180 milligrams as well. Take one of those in the morning. Just helps to regulate my blood pressure throughout the day. Again, other medications raise the blood pressure. They just use this to bring it down. But when it happens to be daltalzine, there's a bonus there. Daltalzine, my main use is not to regulate blood pressure, although it does. My main use is that daltalzine can help, for whatever reason, to keep tacrolimus or Prograf in the bloodstream. So these two, they kind of like to make out sometimes. These two go together. They work alongside, hand in hand to one another. And because I take this, it helps to maintain that level. So I haven't had in the last 10 years very many fluctuations in the Prograf levels because I take the daltalzine. So once they got that kind of a maintenance dose set for me, which for me happens to be 5 milligrams in the morning, 10 at night, that's been what I've been on for years. Daltalzine helps to work along beside that to make that possible. Another medication that you have to take, which is kind of a baseline medication, at least I do, and they may very well put you on this in the beginning. They may give you a medication called omeprazole. This is basically, it's basically for acid reflux. Now this one's not as pretty to me, but that pinkish / on pinkish color, if you can see that. These are those medications that when I first got on omeprazole in the beginning, they put it on me because everything else, you got all these, it's part of the deal. I took it for maybe 6 months and I said, I've never had an issue with acid reflux or anything of that sort. Yeah, it runs in my family, but I've never had an issue with it. I mean, I pop jalapenos all day long. I eat spicy foods. I thought, I don't need that. So I tapered it off and took it away. You know what happened? Wow, I got terrible heartburn and reflux as a result. And it's not something I would typically have had, but because of some of these other medications, particularly back then, the prednisone, this was an issue. So what I found out is I better stay on this maintenance dose for me, which is just one at night, and that is what I take. But that's, again, that secondary category of baseline drugs. So we've got immunocompromising drugs, type 1. We've got baseline drugs, the second one. And then thirdly, we've got some supplemental drugs. Okay, now the person that asked the question, I'll read the question now. I waited this long to do it. But he says, hi, Jim. I would like to know, post-transplant, what your daily medication cocktail is. If you've already done a video like this, please link it to me, and I would like to know what cocktail medications you take daily. Prescription only, please. So I'm sorry, I'm passing what you requested. We're going past prescription now. And then they add thanks. Well, again, I take a daily cocktail, and some of that does include supplemental drugs. Now, a few things you need to know about that. Number one, very few supplemental drugs that I take do I take just over the counter off the pharmacy shelf. I've got one I'll hold up here that is that, but the majority of the others I've taken throughout the years are not that, okay? They are not that, and that's for good reason. I like to get the prescription formulation. Thankfully, my team is willing to prescribe those, but I get the prescription formulation because the supplements that you pick up in the drugstore and the big box stores, whatever, those things are not very well regulated, if at all. And a lot of times the ingredients that are promised on the label, do your research, are not what they're said to be, okay? There could actually be contaminants in there and other things. I'm not getting into that, but they may not be of the highest quality at all. Okay, so I always encourage that if your team decides to put you on a supplemental medication, request of them, can they please put that in a prescription form? For example, I've got calcium carbonate right here. That is a prescription. And so I know by getting it a prescription, this comes from my transplant pharmacy, by the way, not even from the big box CVS, Walgreens, or anything. From my transplant pharmacy, I know that this medication, because it is being distributed from the hospital, here's a key, kind of secret trick most people don't understand. If it's being distributed from the hospital pharmacy to patients in the hospital, number one, it'll be prescription. Number two, it will have been tested to see if it is as pure as it can be and to be sure that what is in this label is in this bottle. So I'm confident this is calcium carbonate, 6 600 milligrams. I'm confident that's what this is because it's prescription from my transplant pharmacy. So I get that from them. I have to take that because I have osteopenia, which is early stage osteoporosis. Why does that happen? Because I was on corticosteroid for so long, because these other medications cause you to lose some bone density, and the fact that I'm almost 50 years old. So it just kind of snowballed on me, but I do take calcium carbonate. In addition to that, I do also take magnesium supplements. Now this looks more over the counter, but it's not. This is a prescription. I won't show you that too much because my personal information on it, but this is a prescription form of 180 milligram magnesium. And I take that from my pharmacy. It comes directly from my transplant pharmacy. And so again, I've got confidence in knowing, one, that it's pure and not contaminated, two, it's been tested, and two, that it is the formulation it promises to be. So in this bottle, there is magnesium oxide. Now, there are other forms of magnesium that could be better, and I would encourage you to ask your team if they put you on this kind of in general cocktail as the questionnaire asks here, right here. I would ask them, are there other formulations? There's magnesium citrate, which is somewhat better absorbed by the body. There's another one I can't think of right now. I don't know why I'm blank, but is even better than that. So this is kind of the worst of the worst as far as absorption, but it works for me. And so when you take supplemental things, try your best to get them in prescription form from a reliable pharmacy. My case, again, transplant pharmacy all the way, and that will be your best bet. The only thing I take outside of that, okay, this is my disclaimer, I do take one medication that comes straight off the shelf, and it happens to be a vitamin D plus a K supplement, okay? Most Americans, period, to some extent are deficient in vitamin D. Okay, most of them are. And that comes from the fact that we just don't get out and get enough sunshine anymore. We just don't drink enough milk or something like that. And you can argue whether dairy should be consumed by humans anyway. I'm not in that argument, but we just don't get it through our diets, and we don't get it through going outside like we should. And so a lot of times we're deficient, particularly in the wintertime when it's not the outdoorsy type weather, or at least when you go out and you're less likely to absorb the vitamin D from the sun, which is the best way to naturally get it. You may need a supplement. Now, my disclaimer, yes, this comes from an over-the-counter medication, but I was sure to get the vitamin D3 with the K2, which just allows it to bind. That works similar to what my daltalzine and my tacrolimus does. Helps it to bind and helps to prevent also the calcium carbonate tied with this, tied with the magnesium, from causing any type of stenosis of my vessels. So the clogging the arteries, the K2 helps prevent that. I'm not a pharmacist, by the way, certainly not a medical doctor, but that's kind of how that works. Now, this one is over the counter, as I said. There is a way, and they have in the past even given me vitamin D from the pharmacy. They told me in this case, if I get this particular brand, this particular formulation right here, I'll try to hold it up so you can see better. They deemed this one as reliable and said it was something they would use. In addition to that, I'm not taking this, nor this, nor this, nor any of these. I'm not taking any of these, particularly these supplements. I'm not, hear me again, I'm not taking them without first the advice of my medical team, okay? Do not, listen close, do not ever, 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 ever decide or determine to take any type of supplement without first consulting your medical team, okay? Number of reasons for that. One, you may be taking something that's just not good for your body, that's not necessary for your body. But two, and mainly, you may be taking something that works against your actual medications that could throw those levels off. So I've heard of people before that they're rocking right along. They got perfect prograph tacrolimus levels, and then they decide to take a vitamin K supplement, and boom, now they have issues. Now they got problems. Not that it's really hurt them, but their levels start to fluctuate. They start to have issues. So always consult your team before taking any supplemental medications, and do not take any supplemental medications that they either are not aware of specifically, and I mean take the bottle in and show it to them. If they're willing to test it, if you're not getting it from their pharmacy, ask them to test it. Ask them to be sure, but don't take it without their advice. Also, I'll add to this, and then I'll let you go. Also, don't waste your time taking supplements anything past a multivitamin, I would say. Don't take a pile of supplements or anything else into your body that's not necessary, folks. They will quickly and very easily do. Your insurance will pay for it. They will run a blood panel that will let you know if you're deficient in calcium, if you're deficient in vitamin D, if you're deficient in magnesium, and on the list goes. They can run a very quick, simple, cheap blood panel on you and determine where your deficiencies are. And if you're deficient, then they can prescribe that supplement to do that, or they can suggest a diet change to fix that. They can do it all kind of ways, but don't take it if you don't need it. If I go in and I get my vitamin D level, for an example, I get my vitamin D level checked every time I go into clinic, okay? And they always tell me, or it's always listed on my transplant portal, it'll say, here's my vitamin D level. If I look at that and my vitamin D level is very good, such as it would be during the summer when I'm outside doing a lot of work in the yard, or maybe, running around with family, the kids, watching them play, if I'm absorbing a lot of the D's from the sun, I may not even take this for the summer. This is a wintertime thing. Same thing goes for my magnesium, my calcium, whatever. If those levels check out positively and you're fine and you're not deficient, don't waste your time taking it. It's just going to make an expensive pee-pee. It's all it's going to do, because your body is going to filter those things out. If you don't need it, it's going to kick it out of your body and to some level. And you don't want to overwork your liver, your kidneys, or anything else trying to get rid of what it might see as toxins, because there's an over and abundance of those things when it's just not necessary. Okay, so that's it. That's what I take. A couple other medications you're on early on. You might be on something called Valsite, I think is the medication. I'm trying to think of what the generic form was or turned to. But anyway, that medication is antiviral medication. In the beginning, you may be on a blood thinner. I'm not on that anymore. I take an 81 milligram aspirin, but that's, again, with the advice of my doctor in that. Just a few things that may fluctuate. You may be on an antibiotic in the very beginning of that. Bactrim is a very typical, very cheap antibiotic that may give you in the beginning. But my main secrets and tricks to this is, one, if you can get a prescription, get it. Two, always get the advice of your doctor and your team on this. Make sure they're aware of everything that you take, and then just enjoy life, okay? Check with them regularly. Request of them, if possible, to bring some of these things down, because the less medication you take, the better you're going to be in the end of that, on their advice. Stay stronger, my friends.